Hi, my name is Tamires Martins. I'm a master student in pharmacology at the Federal University of Santa Catarina, and today I will present the partial results of my current project, entitled as Studies Using the Foursome Swimming Test and Interim Meta-Analysis. So, the foursome swimming test is a behavioral test commonly used to predict the antidepressant effect of substances. Among the quantified behaviors, the most common is immobility, where the animal is in a passive state, just making movements to keep its head above water. With exposure time in the cylinder filled with water, the animal shows an increase in the duration of immobility, and the treatment with antidepressants make this immobility decrease, increasing active behaviors. So the number of publications using the foursome swimming test has been growing since its standardization by Purcell in 1977. Also, with time, many changes and variations of the test were made, as in the apparatus, protocol, and analysis. Moreover, how the experiment is planned, conducted, and reported is changing. Therefore, more and more guides are being created to help with these steps. And then some questions emerged. What experimental features do these studies have? What is the global result? Moreover, what is the quality? So we are conducting a systematic review and meta-analysis, which protocol is already registered. We searched for the keywords in 4 databases. After excluding the duplicates, a total of 5,137 references passed by the selection phase, conducted by 2 reviewers. From the 2,853 references included, 32 publications were randomly selected with the function random between of Excel. One reviewer extracted the experimental qualities and the risk of bias, and the meta-analysis was conducted using the package Metaphor in RStudio. So now the results. Most of the studies used the rats, male, and the research strain. The predominant class of antidepressants was selective serotonin reuptake inhibitors, and the most common drug was fluoxetine, followed by imipramine. The protocol results were more diverse than we imagined, but the most applied protocol was the 50 minutes pre-test with 5 minutes test 24 hours later. The combined effect size was large and significant in favor of the antidepressant treatment compared to control, decreasing immobility in the foursome swimming test. However, these results present high heterogeneity. Ergo's regression test revealed a relationship between standard error and the effect size, suggesting asymmetry on the funnel plot by small studies effect. Trim and Field estimated one missing study favoring control, adjusting HG to 2.60. Nevertheless, using the standardized mean difference as effect size may distort the funnel plot, mainly in studies with small sample size and large effects, because the calculation of standard error includes the standardized mean difference, and may cause a false positive in the visual inspection of the funnel plot and the Ergo's regression result. So we rerun the analysis and plot using the inverse of the square root of the sample size as the predictor. With the inverse of the square root of the sample size against the effect size, the results slightly changed and still indicates a small studies effect, where the minor studies showed a large effect size in favor of the treatment with the antidepressants. We also use the weight function model as sensitivity analysis for publication bias. This test changes the weight of the studies based on the p-values that is most probable to be published. So it reduced the weight of the significant p-values and increased the others. In this sample, more than 70% of the p-values were significant. As a result, the adjusted model presented an effect size of 1.40. and the likelihood ratio test was significant, implying a possible publication bias. In general, most studies' risk of biases was unclear, mainly in the items for selection, performance, and detection bias. This highlights the lack of detailing important information of publication in this area. These results indicate a low external-internal validity in the studies using the foursome swimming test. Further studies are required to understand the heterogeneity within the literature using the foursome swimming test and characterize the source of publication bias. These are the financial supports and the references. Thanks for your attention, and I am available for questions and discussions.